My name is Lourdes Rodriguez, and I serve as program officer here at the NYSHealth Foundation. I'm delighted that you're all here today. Please continue to leave. No offense from anybody on the panel. This is meant to be an informal conversation about time banking. And just to get a sense from those of us gathered today, who is familiar with time banking or has heard about time banking in the past? We have 1, 2, 3, 4, 5, 6. All right, so about a tenth of the room, less than a tenth of the room, is familiar with time banking. So this is going to be a really good opportunity to fold in your comments and what you know about time banking with what our delightful speakers are going to be sharing with us today. The reason for today really is because we talk a lot about how do we address the social determinants of health, and sometimes we find it really hard, first of all, to just be very clear about what we mean by the social determinants of health, and second, about how do you create opportunities for that to happen in ways that not only acknowledge the need that individuals have, but the assets that individuals bring to both their own health and wellness and to the health and wellness of their neighbors. So I am not going to go into a lot of details about today's speakers because you have their bios on your seats. But I am so delighted to be here with Mashi Blech, who is director of the TimeBank at ArchCare, with Mary Anderson, who is a TimeBank member, and with Shelley Hirshberg, who is the board of the Creating a Healthier Niagara Falls Collaborative, and who is in the midst of creating a TimeBank in Niagara Falls. And without further ado, Mashi.
Thank you so much. I want to say a special thank you to Stephanie and Lourdes for organizing this wonderful meeting. Lourdes and I have been making trouble in the community for many years now, and we're very thrilled to be here. So what if I told you that there was an intervention in which 60, 70, and 80-year-olds were reporting not only improvements in their mental health, but also in their physical health? Perhaps a breakthrough in modern medicine, a new drug perhaps? Well, actually it's time banking. And today I'm going to tell you the story of time banking, and I'm going to try to tell you actually a 29-year story of an international movement in about 10 minutes. So I apologize, I have a few notes, I don't usually use them. So for those of you who don't know what time banking is, it's a reciprocal service exchange model that's based on the hour. It's a system of neighbors helping neighbors. So members of the time bank contribute what they can, when they can, and they can get what they need. And for every hour that a member contributes assisting someone in the time bank, they earn an hour and they redeem hours for services that they need for themselves. It's a pay it forward model. And so you're building a new kind of community. And what I really love about it is that everyone's time is valued the same, but most importantly, it's an asset-based approach. So we all know about the challenges in the community, but what I call it the time bank lens, is that we look at the assets first, and that's a very powerful approach. So each time bank, and there are many of them, and I'll tell you a little bit about that soon, each time bank determines what types of services the members exchange in that bank. And time banks, for example, can offer assistance in instrumental activities of daily living. So for example, if a member needs help getting to the doctor, somebody to go with them, the time bank can match them with another member who's willing and able to offer that service. And so, it's a tool that can be leveraged to meet a wide variety of needs for individuals, for organizations that join, and for the community at large. In our time bank at ArchCare, we're very fortunate that we have bilingual and trilingual community organizers that serve to recruit, screen, match, organize the member-led activities, and then partner with the organizations in the community. And typically, time banks use the web-based system that tracks members' information, and it tracks their offers, what services they're willing to provide, what requests they might have, and the actual exchanges they make. So I've been a time banker. This year will be 29 years. I must have been 3, I think, when I started. So fast forward forward, I'm really excited to tell you that there are now hundreds and hundreds of time banks all over the world. And some of them are national initiatives, and some of them are sponsored by organizations. Some of them are very large, but they're grassroots, and some of them are receive government support. So as Lourdes said, time banking is a tool, and it's been leveraged to address some key social determinants of health. So for example, our time bank has been leveraged to increase access to healthy food in the community. It can be access to, time banks have been created just to address educational gaps. Time banks have been created to address safe neighborhood initiatives. So you really can use it to support a lot of different population health management initiatives. I've worked a lot in the past 29 years. I've built 3 different time banks sponsored by 3 very large health systems here in New York City. And our focus has been a lot of aging in community. And so you can use the time bank as a tool to fill in some of the gaps of the formal services, and you can also extend the kinds of services that are available to people, and also the family caregivers you can support, because they, especially with families dispersed around the country, there's a lot of gaps that we're seeing. So I started off, my first 19 years, it was based in a health plan, and there are now other health plans that have adopted this strategy. And so, for example, one of the Blues has launched it about 15 years ago. It's more recently been launched out in California, part of Sutter Health, and they are using, their first initiative is based on reducing social isolation and loneliness, because they recognize the health impact of those issues. Hospitals have been involved in time banking, and so I just got back from a meeting I organized with time bank leaders around the country working in healthcare, and so it's really exciting to hear what outcomes they're getting. But at the end of the 5-hour meeting, one of the family physicians who runs a few FQHCs in Pennsylvania, she got up at the end of the meeting, she said, "It's just the best damn tool I have." So I was like, yes, we need to memorialize that. But it's been used in initiatives. We worked on an initiative that was looking to reduce hospital readmissions, and I'll tell you a story related to that initiative. Super utilizer projects. It really can be used in so many different initiatives. There are physician offices in London that the time bank is embedded into the physician practice, and the physicians give their patients prescriptions to go down the hall and enroll in the time bank. It's really been leveraged a lot in mental health initiatives. I don't have to tell you, if you work in healthcare, you know the power of people feeling useful and needed and supported. In Maryland, it's been named the best practice by the state of Maryland for transportation to the doctor, which is obviously a huge issue in so many places. When I was running the time bank at the Visiting Nurse Service of New York, our wonderful buddies here from the Samuels Foundation supported a study to measure the impact of the time bank on our older adult members, and I believe you have a copy of the executive summary, and I'm happy to discuss any of those outcomes with you. Currently, a time bank I'm running is based in ArchCare, as you heard. It's the healthcare ministry of the Archdiocese of New York. And we have about 1,200 individual members and about 65 organization members that we work with. And we are very excited about some of the work that we're doing that is integrating the time bank with the agency's managed MLTC and their PACE model. So I can certainly answer more questions about those initiatives. I have hundreds of stories I could tell you, but in the interest of time, I'm going to tell you 2. The reason the stories are so important is because the stories really talk about how life-changing something can be. Sometimes by making a simple connection for people. I made matches 20 years ago that still exist today. So I'll tell you, the first story is about Betty. She was a caregiver for 20 years for her mom, and when her mom was in her 90s, she passed on, and very quickly Betty became very depressed because she lost that role in her life. And her social worker was very concerned about her, and her physician prescribed antidepressants, but that still wasn't giving her a reason to get out of bed. And when I called Betty one day, I said the 3 magic words, TimeBank words, and basically it was, Betty, I need you. And so she said, what do you mean? I said, well, I'm going to an international TimeBank conference, and one of the TimeBank pioneers there just had a baby, and I need a gift to bring from our TimeBank. And Betty was the best. So she said, I said, I just need a blanket. And she said, and I know you're not feeling well. And she said, I can't, it was 2 o'clock in the afternoon, she was still in bed. And I said, do me a favor, just think about it. 5 minutes later, she called me back. You want it with a hood or without a hood? You want a matching hippo or you want a matching dog? And basically, it gave her a reason to get out of bed. It drew on her strengths. And the doctor was thrilled that all of a sudden now, when I showed the blankets to the other TimeBank members, they started putting in their orders for their grandchildren. So she had a new role. The other story I'll tell you had to do with the hospital readmission project. And we trained the social worker from that project, was based at the hospital, to enroll members in the TimeBank, because we can't be everywhere, so we work with our partners that way. And so she enrolled a member who had just had surgery. She had broken her only leg. So you can imagine, and she lived alone. So that already didn't sound like a great situation. And she was going home, and she needed help. She needed help beyond what the formal services would cover. So she enrolled, that social worker enrolled that member in the TimeBank, a person in the TimeBank, and we matched them with a TimeBank member who was going to assist her. The doctor wanted her to get to her appointments, to eat healthy, to resume activity, because she was pretty depressed with her situation. So she got all that help from Kathy in the TimeBank. And she was so grateful. She said to Kathy, I'm so grateful for the TimeBank, but look at me in my wheelchair. Well, I can't give anything. And Kathy said, the next day she showed up. She said, don't worry, we'll figure something out. The next day she showed up. She wheeled Dorothy to the local food bank that was nearby, that she also was one of the partners to the TimeBank. And Dorothy spent 5 hours registering people she knew for the food bank, and that she could do, and now she does it regularly. So it has changed her life and how she views herself, and how she's reconnecting with people from her community. So there's also an article that was published recently about Jane, one of our members who had given so much, and then she needed very complicated surgery, and so you'll have access to that, I think, on the summary of the summary. So I'm very, very fortunate to have with us today a TimeBank member, because I can talk about this forever, but really, I am a TimeBank member, and so is Lourdes, but you want to also hear the stories from people who have leveraged the TimeBank for their own health. So I want to say a big thank you to Mary for coming down from Washington Heights this morning to speak with you. Mary is a retired psychiatric nurse. She worked for 40 years in both inpatient and outpatient with both children and adults. But when Mary retired, she's the busiest person I know. She's not only on her community board, she is on advisory committees, she's on Interagency Council on Aging, she's on the advisory board of Isabella Care at Home, she's on the board of directors of Star Senior Center, and if that wasn't enough, she is an actress, and I think the show is tomorrow in one of the TimeBank partners, the People's Theater. She has been a member since 2009. She's recorded almost 900 hours of exchange, and she has received almost 200 hours of exchange. So she'll tell you a little bit about her story. So thank you, Mary.
Thank you for having me. As you heard, I'm a retired psychiatric nurse. I'm sorry? As you heard, I'm a retired psychiatric nurse. I'm a mother and a grandmother. I've been living in Washington Heights for a long, long time now. And when I retired, I really didn't have a plan other than having my knees replaced. And I needed those done one after the other, 6 months apart. And I can tell you right now that if I was a TimeBank member then, I would have been a much happier camper. Okay, so after my knee replacements, I started to do a number of things and get involved in things like the TimeBank. Neighbors and friends that I had made through the years of living in Washington Heights introduced me to the TimeBank, and gotten a lot of services by being a TimeBank member. I'm going to read some of my notes because I don't want to get too scattered with that. So I've had the opportunity as a TimeBank member to provide many services, including volunteering at a church health fair, making puzzle pins and candy cane reindeer with children and adults at several events, and teaching an English conversation class to immigrant adults. Mashi, can you help me take this stuff out, please? Sure. Thank you. I just brought some, I wanted to do a little show and tell since I was talking about these things. And I figured why not bring them?
Matches.
There you go. So these are the candy cane reindeer. Just lost one of its antlers there. Anyway. And I've had the good fortune of receiving emails, visits, phone calls, and escorts to doctor's appointments while I was in the hospital and then in a rehabilitation unit at one of the nursing homes following ankle surgery. And this was last summer. I spent the entire summer. Was not a happy camper by any means. Because summer is my time of the year. As you can probably see, I already have a little tan and it's early in the year, but I like to be outside. And it was not easy being on the flip side of being a nurse. Being a patient was very, very, very difficult. I've not been a patient for that many days in a row. Okay, 2 or 3 days after my knee surgery, I was home. This, I had to be off my foot for 7 weeks, and I said, oh my goodness, how am I going to do this? The TimeBank helped me get through that. Through my involvement in TimeBank, I've gained a real sense of personal fulfillment also. As a member, I'm able to donate credits to other members in need of services when their credits have run out. And I have done that because as a nurse, and those of you that work in healthcare, I'm a giver, I'm a giver, I'm a giver. Receiving is very hard. And I've had to learn how to do that. And I've developed a very close and continued relationship with a lot of the members, many of whom I coordinate with on projects and events and other organizations I'm involved with, especially TimeBank partners. Some of the things I've done with the TimeBank, I've gone on a lot of trips to museums, historical landmarks, and other venues where I wouldn't have gone because I don't like to do those things by myself. But going with the group from the TimeBank has made it a lot of fun, really interesting, and I've enjoyed it all. I've begun to learn how to crochet. Remember, I said begun to learn, okay? I don't know how to crochet, but with my TimeBank member sitting beside me and saying, no, 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 do it this way. No, that's wrong. Come on, no, let me show you again, you know, and actually taking it over and doing some of it for me and then showing me again and again and again, I've been able to do a little bit. And making this napkin holder was one of the last projects that I did. And I actually used this at my students' indoor picnic the other day. So this is really, really a lot of fun and things I can actually learn how to do. I even had a TimeBank member come to clean my oven one time when I had elbow surgery, and I was unable to do that. And I like to have a clean house, and I couldn't stand it, but thank the Lord, somebody way over on the east side came all the way to my house to clean my oven for me. It's never been so clean, that before or since. TimeBank is important to the community. It brings many people together, providing a large contingent of volunteers of all ages with multiple skills, interests, and abilities to help each other and our partners in every way possible. And, you know, I can say, you know, as a former retired nurse that, you know, in looking at it from a nurse's perspective and also looking at it from the patient's perspective, now that I've had that unfortunate opportunity, that the TimeBank provides a very important asset to people who are in the hospital, being discharged from the hospital, because I myself had the experience of my insurance not covering me for transportation or for escorts from the rehabilitation unit to my doctor's appointments. I'm not a rich woman, you know, I had to pay the transportation, but paying for an escort too would have been really, really tight. Fortunately, a brand new TimeBank member was able to do that, you know, a couple of times when I had to go to the doctor's appointments, and got to meet this new member. We became very close friends and have done a lot of things and kept in touch, you know, since then. So, you know, and, you know, as I said, from a personal point of view, when I was in the rehab unit, I got really down and out depressed because of having to be a patient. I didn't want to be a patient. That was not my role. I didn't like it, you know, and every day something was wrong, and but TimeBank members came to visit, or they called me, or they came up, you know, sent me emails, and kind of, you know, kept my spirits up and got me through that crisis, because I'm not sure how I would have done it without them. I'm really not. So I think that's, you know, kind of most of my story, and proud to introduce, we're joined by Shelley Hirshberg, I'm sorry, who's exploring starting a TimeBank in her community.
Thank you, Mary. Thank you, Mashi. Thank you, Lourdes. It may seem overwhelming to those of you that are just listening to TimeBanking for the first time, but I have to tell you, I am so impressed by Mashi and what she's done over the years, and she has incredible colleagues around the country. So the good news for Niagara Falls is, as we begin to initiate our TimeBank, we don't have to reinvent the wheel. We have so many people we can learn from. There are so many stories that their community members can hear, so they can really begin to hopefully accelerate the introduction. But let me tell you where this all started. About 2 years ago, in 1 week, 3 different people in the country called me or emailed and said, have you ever heard TimeBanking? And I thought, I think that's a message, so maybe I better pay attention, because that doesn't usually happen in a cluster like that. So I started talking to some folks about TimeBanking, and I thought it was, within 15 minutes, I just was blown away by the power that TimeBanking can accomplish in a community. It takes money out of the equation. It builds social capital. It builds networking. I thought, wow, this would be a great opportunity to introduce this into Niagara Falls. Now, we've been a collaborative since 2009, and it's interesting, the mayor's philosophy is different from other mayors where they build infrastructure. This mayor in Niagara Falls believes that the power in the community are the people. And so just think of the connection between TimeBanking and really how do you build the power of the residents. And it's a very poor community. So this really, as I said, takes money out of the equation. So we actually created a strategic plan in 2014, spent most of 15 building the governance structure, and the key of the sustainability of our strategic plan is a resident engagement council. They will be the leaders into the future. So we had to kind of give them time to build their capacity, figure out who they were, what they were going to do. So knowing that we had to give the community time to figure this out, we began to socialize the concept of TimeBanking. So going all the way back to December of 2014, we held a webinar for anyone on our listserv to come hear about this. So that was December 14. In February 2015, the Resident Engagement Council had their initial meeting. We had TimeBanking on the agenda. We Zoomed somebody into the meeting to talk about it. At the end of the meeting, the group said, we've got to do this, February 2015. And they said, you know, the churches are already doing this informally, so why not introduce this as a formal process? And the difference will be is where Mashi's coming from the healthcare delivery side, and a lot of TimeBanks are, we're really going to try to link our strategic plan and the social determinants, resident-driven, to initiate it from that standpoint versus healthcare delivery. Yes, it will impact, and I think the healthcare delivery system once it gets going, as you heard from Mary's examples. But so we introduced it. The Resident Engagement Council said, let's do it, and I went, oh my goodness, now we got to figure out how to pay for it, you know, where do we start? But they weren't quite ready yet, and what's interesting is they just launched, actually, a resident leadership program 2 weeks ago to build the capacity of the residents to get engaged, to do projects. So now, I really believe in timing is everything. The timing is right now, so we did one more webinar for our Leadership Council in Niagara Falls I believe it was probably last December, and then took it to the resident council, just to make sure everyone knew what we were talking about, so that there were, if anyone had questions, they could raise questions. So now the Resident Engagement Council has capacity. They are learning how to do community organizing 101, one person to reach out to 3 people or reach out to 5 people. So we had a call the other day with the woman we're working with on the Time Bank, with one of the co-chairs of the Resident Engagement Council, and she's just been anxious to do this. And she's got her plate pretty full, but she's anxious to do it, and she really gets it. So she's actually going to reach out now to bring together a small working group, and that group will determine, they have to address a lot of questions. So one of the questions they have to answer is, what's the role of the Leadership Council? Who's going to own the Time Bank? Who's going to actually launch it and operationalize it? When are they going to get training? What technical assistance do they need? Do we need at some point a full-time person? They have a lot of options. We could have volunteers that step up and say, we will help launch this and be the glue. And they're going to start small, and they're going to really try to let it evolve organically. So they do have to figure out over time, that I don't think they need a full-time person to start, but they have to be cognizant of the timeline, and as they grow, well, to kind of be ahead of the game if they have to hire someone. So they have their volunteer leader. They're going to put together a timeline, and they're going to also have to look at, well, I talked about the paid staff. What they did say, and they're very, very strategic about this, they're going to be slow, they're going to thoughtfully plan the ramp up to produce value for the community, but also to be thinking about the ROI for sustainability over time. So there's a lot they have to think about. Now what we've done is we're really going to try to tie this specifically to the goals in our strategic plan. And I'll give you a couple of ideas. We have a healthy behaviors work group. And the objective they have is to reduce unhealthy behaviors and problems. So an example how time banking could help is adults with experience in diabetes could educate other adults and receive time credits for doing that. So that's an example of how we could tie it to our strategic plan. We have another work group, job training, job prep, local hiring. Their objective is to increase the number of local meaningful employment opportunities. An example could be focus on weatherization, housing, to develop young adult skills and employment opportunities, and they can receive more time credits. We also talked about maybe having in a neighborhood a shed that has a lawnmower and a snowblower, and have the youth get engaged and going out and each managing a neighborhood and getting time credits. We're definitely thinking about how youth can get engaged. And then we'll have a transportation work group, and their objective is to promote the accessibility of all programs and services to improve the quality of life. An example there could be driving people to medical appointments or grocery shopping. Grocery shopping is an issue in Niagara Falls, and a lot of folks take taxis. And they can receive time credits for that. So those are a few examples that I think as the group organizes, they will be very strategic about how to tie this in, but also it's going to be organic, and it's going to go where it's going to go. And the other thing that's kind of cool is, we were talking the other day, is this small group that comes together, they can informally start the time bank. They can write, their first meeting, they can sit down and write, these are the 5 assets I have that I can contribute, and these are the 5 needs I have. And so that little group can begin to play with time banking amongst themselves as they get going and really experience what that feels like as they get bigger and bigger and bigger. And hopefully we can do that pretty quickly, but we'll see. Let the community drive it. So, Lourdes.
Back to you. So while our audience starts working on the questions, I have a few questions of my own. Mashi, you mentioned the Affinity Group of folks that are working in Pennsylvania and that are coming together to share best practices. Could you, we could go all day on this topic, but could you talk a little bit about what are some of the best practices that have started to bubble up of that group, or how they're structured and what they're hoping to be able to achieve?
Well, in that particular group, it was really for people who have been doing time banking in healthcare, not just thinking about it, but already have some of them many, many years of experience. And so we come together each month, we pick a different topic. And so last month, for example, measuring outcomes is, a big question, and we are actually looking to share tools and looking to see what is reasonable, because most of the time banks are busy building programming. And so the measurement part, they may or may not have the resources to do, a lot of measurements, so that comes up as an issue. This last meeting we had in Pennsylvania, there was a time banker from Michigan, and she's in the Detroit area, and that's a very depressed area, and so she has been organizing a time bank for years now. So now the local hospital is, saying, why don't we contract with you and, see if we can. They won't sponsor the time bank, but they're going to develop a contractual relationship to then address some of the needs the hospital is seeing. So we're helping her to figure out what that could look like. So it's really developing leadership. I mean, we were also very grateful to the Samuels Foundation. Gave us a grant to develop leaders, because that's so critical. Our time bank is one that keeps growing, and we never want to say, we're at capacity. There's no such thing. So in order to keep growing, we need to have ways to have members be part of the day-to-day operations. And so we got a grant to sort of figure that out, and it had to be, half of our members don't speak English, so everything had to be in Spanish and Chinese, and our life is complicated but wonderful that way. So really figuring out how to develop team leaders is an issue. But there's also another group that's for new people who are just starting out in time banking, and that's a monthly coordinator call. And that's also open to everyone in the community, and I can certainly share more information about that.
Great, thank you. So Mashi, you also referenced earlier, the question was not for you though. You also referenced that there are services that are not covered by insurance companies. Mm-hmm. So Mary, I have to ask you, walk me through the moment when you were on your way to get your ankle surgery, going to the appointments, coming back, like how many volunteer hours did you have to receive, and what would have been plan B for you?
Well, first of all, when I found out that my insurance didn't cover an escort, I was really, talk about depressed, I was really upset, and I was frazzled, and I didn't know what I was going to do. But then after I, settled down a little bit, I thought, time bank, oh yeah, let me call only a quick. So I made that phone call, and it was actually about 5 hours each time that I had to go for the doctor's appointment, because we were in Washington Heights, where I was in the rehab unit, and my doctor was on 51st Street. So coming with an ambulette that I had to pay for all the way down to 51st Street in the morning, New York City traffic was a trip. A trip that I don't want to have to do ever again, but had to do that 3 times. So that was like 15 hours of escort service from this particular volunteer. And my appointments were on a day that she happened to be not working. So it was fortunate that I was able to have the same person all 3 times. If I hadn't been able to get a time bank member, I would have had to pay for an escort. And I don't even know what the going rate is, because I didn't want to find out. It was enough I had to pay for the transportation itself. But, pretty pricey. So I would have had to pay for private transport service.
All right.
And I think there were 9 different members who helped during that particular time. And that's the other thing, is you can spread out the need over a larger base of individuals, as opposed to even people who have family members. They may be working and maybe not be able to take off another day that week, and go. And also people, don't have family nearby or don't have family at all. So you spread it out, and it's not a burden to one particular person. We had a member who had to move and was totally overwhelmed by the idea of, she lived alone, and the idea of having to move, just, she was getting panic attacks. So we said, no problem. That's what time banks members do for each other. And we put out the word, and I think we got 10 different people coming at different times. And she was like, I finished packing 2 days ahead of time, and I sat there going, I didn't know what to do, you know, so that's what the power of TimeBank, leveraging a large group of people to meet individual needs.
Great, thank you. And Shelley, you mentioned that time banking takes money out of the equation, but time banking needs money to be set up and to be managed, and that can happen in many different ways. Can you talk a little bit about your thoughts about the role of money to set up the time bank in Niagara Falls?
Well, the initial money we really needed to launch was in hosting a training for the residents. And that price tag was about $10,000. So in February 2015, when they said it's a go, they want to go, I began to kind of think about that. And we were really lucky with the New York State Health Foundation. They have been very, very, really on top of community engagement. So I've been talking to Lourdes saying, you know, we need to do resident leadership, we need to do time banking, and so we were able to actually get the training financed. Haven't talked to I think this is a conversation I will have as the residents begin to organize what it looks like. It's really going to be driven by their preference. I do believe that our Resident Engagement Council, they have several things going, and they just need a full-time community organizer, you know, to help them with their leadership program. Everyone's working, everyone's busy, and to help with community currency. So the ideal situation would be is to go to the collaborative members at some point when we begin to show the value and can have some of the stories to go to them, to the collaborative, because there are, and say, look at guys, we need each of you to contribute. So if we want a $40,000 community organizer and we have 20 people at the table, okay, we're going to share this expense. So that, to me, I want to begin to engage a collaborative in a very meaningful way. We've already started the precedents this summer with MapSport. We got the FQHC and the 2 hospitals that each contribute for the field coordinator program. So I think we've set the precedent, but we have to broaden that. And if people can't, if the organizations can't give money towards it, then they can give staff. That's another thing too. We have an FQHC who's donated a half-time executive to help run the collaborative this year because, you know, I can only be in so many different places as a volunteer. So she's set the precedent. She's also put out the gauntlet and said, I expect all of you to do the same thing. So I think I would like to not necessarily get grant funded, but to actually go back to the community and say, community, we need you to kind of really support this. And I think, you know what, I think they will, but we have to kind of have a product, we have to show how it's working.
Right. So I want to make sure that I take questions from the audience.
The word community keeps coming up, and it's hard in New York City to identify a community because there aren't necessarily natural communities given the way the city bounces around. So how do you do community in an urban setting? And I guess the second question is, time banking needs a mothership. It needs somebody to keep the books and to make sure that things are working okay. And there's a trust issue there. Who can host or help manage this? Because again, in the city, you don't necessarily have trust of all organizations or entities that are out there.
Mashi, you want to take it?
Well, I'm a native New Yorker and born and raised in Brooklyn. I lived in the Bronx, I lived in Manhattan. My perception of New York, it's like a cluster of a lot of little neighborhoods, and each one has its own flavor. And so each community is unique, and I think that, you know, some of them have more cohesion than others. And so you need to go and you need to, you know, the basics of any community organizing, you need to talk to the people who know those communities and see what's working well, what's not working well, see what gaps there are, see what interest there is. Because there may be a huge problem and everyone feels like it's just not, you know, you can't address it, it's not going to work. And so in each community, you sort of need to have a person, a leader, whether they're paid or not. You need to have leader or leaders that people trust. And so that it's all about the trust. So when we go to a community, we have those conversations before we even think about perhaps launching in that community. We have to have those conversations with those leaders and see what will work. But, you know, I was telling Shelley earlier, when we launched in Lower Manhattan, we were told by the leaders not to even consider trying this initiative in Chinatown because cultural issues, it would not resonate to have people who didn't know each other exchanging, helping each other out. There was no precedent for it. So we listened really, really carefully, and because the leaders know their communities, and so we decided that we were going to try anyway, but we were going to change the model, tweak. You have to tweak the model to make it resonate for a particular community, and so we changed it up in a way, and now it's a third of our membership is Chinese speaking, and it's the fastest growing segment of our membership. In terms of who can sponsor or support a TimeBank initiative, anybody. Anybody, some of them are supported by their members. There's a grassroots initiative that's now part of our TimeBank. They're women who started it 20 years ago, and they've been running it on their own, but they don't have a way to track their exchanges and do all that, so they joined as a subgroup of our TimeBank. Organizations can sponsor it. We've had government support now. The city council members are supporting this. The borough president's office is supporting it. So you can get support, an organization, if an organization has a particular mission or issue that they're dealing with, and you can show that the TimeBank is valuable to meeting those goals, then it would be in their interest to support, especially if you, in the Michigan case, they already had something built. They're not starting from scratch. So if you have something that's running and already successful, it's a smart business for organizations to leverage it.
Hi, thank you. I was wondering, I think it was Mashi, you mentioned the health insurance and the payers, and that they have either are supporting TimeBanks in various entities, or that they could. Could you talk a little bit more about specific ways they're supporting TimeBanks or ways they could?
In health plans, you mean?
Please, yeah.
Well, for 19 years, I did it in a health plan. There was a social health maintenance organization. It was a pilot, a 19-year demonstration. It was a way to keep people home who were nursing home certifiable, and really by offering some in-home services that are not typically covered. So they saw this as a way to extend what they called the chronic care benefit. So there were services that, even though they were offering beyond what Medicare typically offers, there were still services that were gaps. So they saw this as a way, at first, of extending the services. So if someone had a home health aide 3 days a week for a few hours, then maybe they needed someone else just to handle the shopping because they didn't trust the home health aide with money. I mean, there were all kinds of situations that the TimeBank would be used. And also to engage people who were homebound to really, as providers, and being able to still feel useful in their community. But then I started to think about it. I said, well, the people who are the sickest, they sometimes get a lot of services, but there are people who just fall short, who are not quite sick enough to be eligible for many more services. So we started to initiate a focus on individuals who were starting to have difficulties with IADLs, but were still managing their ADL care, but with things outside the home. So we started initiatives around that. The one in Pittsburgh is based in a health plan. My former COO moved to Pittsburgh and started their Medicare product and said, I want a TimeBank here. So it's been around for about 15 years in their blue. And they use it as a tool for a lot of access to healthcare, a lot of rides to the doctor because they're not in urban areas. And their TimeBank is also used for a lot of social initiatives to reduce social isolation as well. The one in California, as I said, their focus right now is on loneliness and isolation, and they're actually have the resources to do the measurements. In January, we'll get the report from that. But there were initiatives that were done to address diabetes care. So as you mentioned, you can have people, we did some of that work in Washington Heights with the UHF initiative to try to diabetics, our members who are diabetics who are well controlled, were serving as leaders and group mentors to others, walking clubs, healthy cooking groups, all kinds of initiatives you can leverage the TimeBank for, reducing ER visits for asthmatics. It's been leveraged in many ways by health plans.
And the funding covers the matchmaking piece of the and the tracking and the screening,
Right, right.
not the services that the members give to each other.
There is no money that ever exchanges hands in the time bank.
I have a question, following up on what you just said about are members screened, or are there issues around liability?
Well, this is the US. There are always issues around liability. We're a very litigious society. Of course, each time bank has to decide what kind of screening, and as Shelley talked about that advisory group, each time bank, before they open their doors, have to decide what kind of screening they're going to do. So we try to create a balance between having what we feel is, due diligence that makes sense, but is not to the point where people will feel it is so excluded and feel like it's unmanageable and won't come to the party. So each time it has to make that decision. And the liability, it's another issue that gets discussed before the time bank launches. How is the time bank going to handle that? So there is, if you're sponsored by a large organization, we were covered under the general umbrella policy of the organization, just like any other volunteer initiative they might run. So we didn't have to pay anything extra to have that. We just informed our carrier that we were launching a time bank. But we also do purchase coverage through SEMA, which is a very, very inexpensive. We don't have to, but we choose to purchase coverage for our members. That covers them for liability. But I have to tell you, I've been doing this for 29 years now, and the good news is that there has not been, and it's all around the world now, generating millions of hours every year, and there's not been a terrible story. People are still, the reason volunteer insurance is cheap is because as litigious as we are in this country, people still not tend to sue their volunteers.
So, last question.
Oh,
Yes.
here. I was one of the people who never heard of
Time
banking until you send the email. And I have a question about the categories of services. How do you decide as to the services that you decide to provide? Do you limit them, or do they vary from Shelley's idea to what is happening here? How is that decided?
Well, each time bank has their governing group that makes that decision, and there are time banks that had a baby delivered on time credits, and the only thing that was the lab work. So there was a wedding that was done completely, the place, the music, the food, the photography. So, each time bank decides, we had doctors in New York who were willing to give care to uninsured through time credits, but because we're sponsored by a large health system, we have chosen to restrict the services to typically non-licensed services, so we're not getting into having to check, accreditations and so it's the kinds of services, and there's I can show you a list later afterwards. There's tons of things that neighbors can do for each other that are very meaningful. But I was picked up when I went to give a talk in Maine to their time bank. I was picked up by a woman who was a member of their time bank, and she was picking me up because she needed the time credits to get her wellness visit at the local clinic. So there are plenty of lawyers and doctors and accountants and licensed services. We just, in our time bank, there's so many ways people can help beyond that as well.
So we'll follow up with sending you the list of services so that you get a better sense of how time banking works. And I want to be respectful of everybody's time. Are there any burning questions? I'm about to put somebody on the spot.
The only thing I was gonna say
Yes.
is that DIFTA has a program, I don't know if you're familiar with it, that allows people to volunteer to help elders for different things that they need. That might be a good collaboration point, but it also has a model for how they vet volunteers that other people can use to kind of create other time banks.
Can you repeat
Yeah,
the comment so that it's on the record?
The comment was about DIFTA, the Department for the Aging here in New York, and they have a model which encourages volunteers to help others in the community, and we actually are a partner to DIFTA. They actually ran a time bank for many years, and that's a whole nother story, but if you base it in a government entity,
Survivalist.
it's not pretty often. So because, And then they realized that that was going to be challenging, and they were looking to contract with us instead, because that, you know, you have to be careful of where you embed the time bank and what the restrictions might be based on, you know, the sponsoring agency. I'm happy to hang around for some time and further discuss or give you cards or any other questions you might have.
All right, I'm about to put one person on the spot, but she's been forewarned. Erin Barnes from In Our Backyards is here. And can you give me 2 sentences about micro-philanthropy and time banking?
Yeah, totally. I'm sorry for showing up late and being ignorant of what everyone has said so far today. IOB supported a cohort of projects that were all to create new sharing economies across the country in partnership with Center for New American Dream. One of the best ones was actually the NOLA Time Bank. It was just this incredible project, and so they actually were able to crowdfund the funds that they needed to cover some of the administration and transactions between, to administer the entire group, so that no money would ever have to change hands with the members. It was a really interesting model. We made a short video about it that's on the IOB video page about starting a time bank. And it's been really cool, and the things that I've heard from New Orleans has been transformative for the community.
Great, so we'll add that to the resources that will be put in the summary page. And with that, I want to say thank you so much for your kindness and sharing your stories. And thank you, all of you, for being here today. And long live time banking.